Hi everyone, I'm Ginny Rogers and we're going to be talking about Kegels and why they are not always the option. So a lot of times when we go into our providers, if we're having a little bit of urinary leakage, maybe difficulty holding in gas, maybe some fecal leakage, our providers have sometimes suggested doing Kegels. In the past, this has been a very common thing to give, and a lot what research in the past used to support. So a Kegel is doing a pelvic floor contraction where we do a big squeeze with our pelvic floor muscles. A lot of times to be able to do a contraction, I will tell people, imagine that you're squeezing a blueberry. So the blueberry is sitting at your vaginal opening, and imagine that you're doing a squeeze up and in, trying to pick up that blueberry, and then putting that blueberry all the way back down. And that is how you do a Kegel. So a lot of people think that when they're having urinary leakage, that their pelvic floor muscles aren't strong enough to keep that urine in, which is sometimes true. Our pelvic floor muscles are the gatekeepers to everything. So they're responsible for being strong and sturdy to keep everything in. They're also responsible for being able to relax, to let things out or let things in, depending on that whatever activity is going on. And when people come to us, a lot of times people will say, I've been doing Kegels. I've been doing a Kegel every single time I'm at a stoplight, or every single time I'm sitting, I'll do a bunch of squeezes. But that is not always helpful for urinary leakage. When people come to us, they typically have one or two problems going on. One, either they're having pelvic floor muscle weakness and those muscles aren't strong enough to keep everything in, or two, we're having pelvic floor muscle tension. Pelvic floor tension is when those muscles are stuck in a shortened position and they're unable to do their job as gatekeepers. So when those pelvic floor muscles are stuck here, they're unable to fully relax. They're also unable to fully contract to keep urine in. So this can also be what is contributing to our urinary leakage. And a lot of times it can be a combination of tension and weakness that contributes to our urinary leakage. So I'm going to explain it as if it's a bicep curl. So our biceps do this motion right here. They're responsible for bending that elbow. If my bicep is stuck in this shortened position and you ask me to do a bicep curl, we're not going anywhere because there's a lot of tension keeping it from doing its job. So what we first have to work on is lengthening and relaxing that muscle so that it can even be available to do a contraction. So in pelvic floor therapy, a lot of times we work on relaxing and lengthening those muscles so that they're available to do their job as gatekeepers. So sometimes coming to therapy, it looks more of training our breath, teaching stretches, having the physical therapist work on your pelvic floor muscles to get them to lengthen and relax, and teaching you options of how you can work on your pelvic floor muscles independently at home to get those muscles to relax. Sometimes when we are able to fully lengthen those muscles, that takes care of our urinary leakage and it goes away because those muscles are now able to go through that full range of motion. Sometimes once we work on that tension, it exposes the weakness underneath the muscle. And then we begin to work on retraining the muscle of how to do a squeeze, or the coordination of how to do a squeeze when we need it to, and then how to fully relax afterwards. If our muscles are stuck here and unable to fully relax, then that tension can return. So working with your therapist of how to relax those muscles and then train strength, coordination, endurance is how we work on getting rid of urinary leakage. And a lot of times that's only a part of the puzzle too. We want to look at full body. So we'll look at breathing, we'll look at how your core is working, we'll look at how your glutes are working, how your back and your hips are moving, because that is all a part of how those pelvic floor muscles are able to activate. So there's a lot more that goes into urinary leakage control of bowel and bladder than just doing a Kegel. So this is Mythbusters time of how Kegel is not always the answer. Thanks for watching, and hopefully you know more about how to work on urinary leakage now.